Our final speaker in this session is Dr. Ellie Pearce. Ellie has a research background in evolutionary anthropology and is research fellow and network coordinator for the Loneliness and Social Isolation Network in the Division of Psychiatry at UCL. This network focuses on how mental health and social connections relate to each other, whether tackling loneliness is a potential way of improving the mental health of our population, and how to reduce loneliness among people living with mental health problems. And they bring together a wide range of perspectives on this topic. So over to you, Ellie.
Brilliant, thanks Zoe. Yeah, you've basically done a wonderful introduction to the network already, but just to emphasise that we are interested in how addressing loneliness and social isolation in the general population may help prevent the onset of mental ill health, and we're interested in looking at the experiences of loneliness and social isolation in those who already are experiencing mental ill health, and how we can address that with them as well. I feel like the other speakers, Emily, Sian and Alice, have given you wonderful tips already. And I think quite a few of the things that I'm going to say are kind of emphasising or re-emphasising that, but I would echo everything that's already been said really well already. So we've already run our 2 funding calls as well, so I'm afraid there's no more opportunities to apply for funding from our networks. And our 2 calls reflected the 2 phases of our network. So the first call was on pathways between loneliness, social isolation and mental health, so understanding why there seem to exist these associations between those experiences. And for that first funding call, which we ran this time last year, and had our decision by kind of March this year, we received 26 applications and we awarded 6 grants of up to £30,000. And 5 out of 6 of our teams are led by ECRs. And I think I spotted Gemma earlier, one of our principal investigators, who will talk about her project later. And I was just going to pop into the chat on our website a description of all those projects, because they're all fantastic and I think you should read about them. And our second call, which we've just decided on the funding for that, was on interventions. So what we can do to address loneliness and social isolation to prevent or alleviate mental ill health. And this call closed at the beginning of October, and we held the reviewing panel this month, and we've just awarded 6 projects, but we haven't announced those publicly, so I can't tell you anything about them. Apart from that, again, 5 out of 6 are being led by ECRs, so we've had a fantastic set of applications led by early career researchers. 73% of the applications were led by ECRs. So each of our applications, it goes through quite a similar process to what the other network reps have already told you about. And each of our applications are reviewed by 4 reviewers. So 3 of those reviewers are co-investigators on our network from a range of different disciplines. And at least one of those reviewers is a kind of expert in the methodology or the particular focus of the project. And then the 4th reviewer is someone from our lived experience co-production group, and they particularly focus on the patient and public involvement plans for the project, whether people with lived experience have been involved in the development of the project, and whether they're properly budgeted in the proposal. And the applications had to involve lived experience perspectives. Most of them involved a co-applicant with lived experience relevant to the call. They needed to be multidisciplinary, and we really emphasised the fact that we really liked cross-sector collaborations. So having a 3rd sector co-applicant, for example, was very highly rated by our review panel. So some top tips, again, echoing everything that the others have said, but emphasising these ones as well. And so some of these seem very obvious, but you'd be really surprised. So making sure that you complete all sections of the application form, you know, get someone outside of your team to read through your application form and make sure you've covered all the material. And again, looking through for typos, it really does make the application look very rushed if there's quite a lot of mistakes, or yeah, you've started a sentence and then not finished it. And be really clear about how your application fits the remit of the call. So for example, in our case, in some of the applications, we really would have liked to see more clarity about the different disciplines that the proposals were bringing together. And if the call is about, for example, loneliness and mental health, make sure that you cover both, not just one or the other. For our application, you needed to write a lay summary as well as a research abstract. So that was mainly for our co-production group members. And if you're asked to do that, then really make sure that your lay summary is accessible and it's not just a repeat of your abstract phrased slightly differently. There was a real difference in applications where the applicants had made a real effort to write their lay summary in a slightly different, with a different audience in mind. As I said before, we really like to see co-applicants with lived experience and from the third sector. And those co-applicants really need to be involved from an early stage in developing the proposal, not just added on at the end because it looks good. And really think through timelines and whether it's feasible. And I think in thinking about that, it's probably helpful to get someone outside of your team to look over your Gantt charts and your plans to make sure they think it's doable given the time that you've budgeted for and things like that. So as well as getting colleagues to read over the proposal itself, it might also help to present your proposal in, for example, a departmental seminar or in a meeting with other early career researchers. I think you probably get a broader audience that way. And again, getting lots of feedback early on to try and develop your proposal and make sure it makes sense and that it fits the remit of the call that you're applying to. And overall, just give yourself time. As I said, you could really tell the applications that had been a bit of a rushed job and those that had really been thought through very thoroughly. So the other opportunities that we have for ECRs in our network at the moment, and I should say that we're in the process of going into the second half of our network, and we haven't really started planning things in detail yet, so there may be more coming up. So we're currently working with a fantastic team of ECRs to do a review looking at potential pathways between loneliness, social isolation and mental health, with different working groups of ECRs looking at different domains of potential pathways. And I'm a bit wary of letting the group get too massive because it's obviously harder to coordinate people. But if you are interested in collaborating on a review in that area and you do have spare capacity, then please do get in touch. I can put my email in the chat in a minute. We're also planning some writing groups in the network to develop larger grants building on the work that the network has already done. So do keep an eye out for those opportunities to get involved in those developing larger grant bids. And we're also really happy to put people in touch through our Making Connections section of our newsletter. So if you're looking for instance, a PhD supervisor, research collaborators, a charity in a particular area, then if you send me 100 words kind of talking about who you are, what you want, and your contact details, I'm very happy to put that into our monthly newsletter. And also we do advertise opportunities for ECRs in our newsletter for so things like mental health blogging, when there's opportunities to write mental health blogs and other things like that. That's in our newsletter. And you can sign up to our newsletter through our website, and I can put that link in the chat if Andre hasn't done it already. And we're also very active on Twitter, so that's another way to get involved and to see the different opportunities that we have available. And that's it. Thank you very much for listening. It's fantastic to see so many people here.